Tim, this is Dr. Cunningham. This is no April Fool's joke. It's April 1st, 2010. We're inside your right shoulder, which didn't feel super unstable. There was a little bit of looseness there. There's your labral tear down there. It's pretty small, but it's indicative of an instability problem. There's some more damage there. Ooh, that's pretty significant there. Right along there. So we'll have to tighten this and repair those two. Looking at your rotator cuff, go ahead and abduct him. Yeah, I just want to take a quick look. That cuff, biceps looks good. Okay, internal now. No, that looks great. It's got a little bit of... Okay, now back down. Let's see if he's got a little heel sacs there. See it right there? A little bit of where subluxation occurred. Some of that's from the scope. Yeah, it looks okay. So we should be able to tighten that. This looks fairly chronic. You've got a lot of damage here to the... We're getting that flickering again. A lot of damage to the cartilage here. Alright, we're cleaning up all this damaged cartilage here. Not much we're going to be able to do over here other than smooth it a bit. That's real concerning there. Alright, Pete, pull out. Let's get down. We got to get this lower labrum. I think this is the one we saw on the MRI right there. Yeah, there we go. Let's go ahead and open a 50, please. I'm going to use the heat chondroplasty to try to smooth this a little bit better. A lot of damage even way down here, doesn't he? This labral tear comes all the way up to the top. So this is kind of a combined slap or superior labral tear and a Bankart lesion from instability. Looks like that's happened several times. All right, let's have a probe, please. And Pete, let's do a rollback. Let's see if we need to fix it up top. It's clearly disrupted right here, but let's see if it goes any higher. There's a little split there, but I don't think it's rolling back, is it? Let's just cauterize that. Let's look at the front. Look from the now, looking from the front, you can see the real depth of that damage to the cartilage surface here. I'm going to clean that up. Let's go ahead and have the, you have that small sheath, or did you open it? Go ahead and open me the green one, the small one, or the aqua one. Certainly not too loose to the back, is it? And I don't see any labral tears to the back. Yeah, teal is the color. Let's go ahead and take the shaver and work on this a little bit from behind here. You want to screw this home here, Pete? Okay. Tighten that piece down. That'll keep it from linking, I think.
Huh? I think it's fine. Yeah.
Try to get this a little bit smoother here. Head still looks good, so there's no real damage to the head. And he just took a chunk out of there, didn't he? Try not to get down to grade 4. I think we're going to do better with the cautery. Okay. Go ahead and screw that back in. There's the loose capsule we're going to tighten. There's the subscapularis on the other side here. Whoop, big loose body. That's where you got to look, right there. Okay, so let's have the switching stick. Look at the size of that. There's your loose body. We're going to have to get it from the front. It's trying to suck out of there, isn't it? But this thing's too small to grab it anyway. So let's just come from the front. Switch. So there's your big Easter egg. Happy Easter. Sitting in your shoulder joint there. Try to grab it and pull it out if we can. Suction punch. We've been chasing that big loose piece all over the place. We're going to wait till it shows back up. We got to get moving here. You're getting so swollen from all this chronic cartilage damage. We're using a heat probe to do a little chondroplasty, a little surface chondroplasty. Smooths it better than the shaver does. Doesn't take as much cartilage away. A lot happier with that. We saw a little bit of a second ridge there we'll get. Okay, biceps is there. The synovium out of the way. This is really close to grade 4 damage on your glenoid, which means all the way down to bone. I'm trying to save the edges by smoothing them. Really peeled back here, you can see. This is probably where the loose body came from right here, and it's actually probably doubled or tripled in size sitting in your shoulder all these months. I'm going to release the labrum here. Okay, switching stick.